As social beings, we need connection with others. Research has shown that loneliness can impact a person's mental health. So how does one recover from that isolation experienced from the height of the pandemic? UMass Boston and AARP have launched Reach Out MA, the task force to end loneliness and build communities, a campaign to mobilize individuals, communities, and organizations to address social isolation. AARP Massachusetts President Sandra Harris and UMass Boston's Dr. Coyle are here to tell us more about the task force.
Good afternoon, everybody. I want to say I'm so grateful for the yoga that we just completed. I'm feeling very zen. I'm feeling very relaxed. That was really lovely, and it's really a pleasure for me to be here with you this afternoon. I'll start just by introducing myself, and then I'll invite my colleague Sandra Harris to introduce herself as well before we begin. I'm Dr. Coyle. I'm a research professor at UMass Boston in the Gerontology Institute and a co-director of the Massachusetts Task Force to End Loneliness and Build Community, which has been in place since the very beginning of 2020, just before the COVID-19 pandemic really began in the United States. So I do a lot of work at UMass Boston Gerontology in communities, working directly with senior centers and local officials to help plan for what we are experiencing, which is population aging and a desire for older people to remain living in their community. And I'm delighted to be here with Sandra Harris. Sandra, take it away. Why don't you introduce yourself and then I'll get us going.
Hello, everyone. I'm Sandra Harris, and I am, as Caitlin has said, the state president of AARP Massachusetts. And as state president, I am the lead volunteer for AARP Massachusetts. And as you all know, that we work to make sure that older adults and 50 plus get to choose the life that they live as they age in the Commonwealth. It is truly my honor to be here today, and I'm equally honored to share this task force with Caitlin. She has been a real partner and an inspiration to all of us as we begin this work. As she said, we began this work in 2019, prior to COVID, when we began to see the way loneliness was impacting or manifesting itself in our communities. And we knew that we had to join forces to make a difference. So here we are, and we're really happy to share with you the work that we're doing and our goals for the coming years. So thank you. Caitlin?
Thank you, Sandra. Thank you. So I'm just going to give us a little bit of background in terms of how we came to be a task force and what we've been up to. And then Sandra is going to end our comments with outlining our current work and our most recent set of goals and what we'll be up to in the future this coming year. So why do we exist? As Sandra mentioned, we came together in 2019. Sandra, I have my research background is in sort of age-friendly communities and really developing programs and interventions that help people remain in their community and to build communities that are inclusive and accessible for folks who are aging, as well as those who have some level of physical or cognitive impairment. What we know from empirical evidence is that being disconnected from other people has serious consequences for mental and physical health. That is extremely clear. I list here about 4 different pieces of data that support that. In terms of social isolation contributes to mortality just as much as smoking 15 cigarettes a day when we look at sort of the risk for mortality. Estimates have suggested that close to 40% of Americans report having insufficient social connections. I think that's important to note because we're talking about this in the context of aging. We are here today at the senior conference, but this is by no means a challenge that is faced only by folks who are older adults. In fact, we're all aging and we're all, I think, struggling, especially during COVID, to really stay connected. And so that's an important lifespan issue. We do know that living alone, being unmarried, having mobility limitations are just some risk factors for being socially isolated, as well as the geographic dispersion of families. We're living in a global society, linguistic barriers, and the loss of social network members due to death, illness, or moving. So all of these things, as a gerontologist, it's really important for me to say that social isolation has been something that has been studied and trying to be, been addressed for decades. This is not a new thing, but COVID-19 has really shoved it into the spotlight. And I think our task force really came about at a timely point in our history in terms of being able to draw on what we do know about isolation from an aging perspective, but also to activate our state and our community around this issue and really trying to spur change. So we know that there's a problem, but we have in terms of the research, we know a lot less about what works. What are the prevention mechanisms? What are the interventions that can alleviate this issue of isolation? We have so much evidence about the problem. We have a lot less evidence about the solutions. And so that has really been one of our main focuses as a task force is to not just create new solutions, but really to look into our communities, understanding that communities are staying connected in their own ways and trying to lift up that creative work to a state level so that we can learn from one another and continue this work through the pandemic. And so why do we have less of evidence about these sort of solutions? One, we know the capacity at the community level. They're doing innovative things. They're trying to keep their neighbors connected, but they're not necessarily don't have the capacity necessarily to collect the data, so to speak, or the evidence. And so that work is really valuable to their individual community, but is less sort of brought up to the larger level. We know that stigma. People don't want to say that they're lonely. They don't want to raise their hand and say that they're socially isolated. And so when we think about developing programs and interventions, we have to be really aware of that in terms of, people's willingness to participate. There's also an overall lack of public awareness of the problem. And that's another sort of key focus of our task force work. We know there are, lots of sort of big national global movements around taking care of our physical health, taking care of our mental health. But we don't really see as much emphasis placed on the fact that we all have some level of social health, the ability, the amount that we stay connected with our peers and our friends and our neighbors. And we don't necessarily think of maintaining that social health as being as important as the physical and mental health, despite the fact that we have data that suggests that it is. It's also a complex issue with confounding causes. People don't, sort of become lonely or isolated overnight. It is, especially when we're talking about the aging population, it's something that can happen and sort of develop over a life course. And therefore, the interventions and the preventions are often, I think, sort of complex in terms of how we think about developing them and at what point are we trying to alleviate the issue. So all of those reasons sort of really motivated our task force to say, okay, we're here in Massachusetts, we have a lot going on at the local level. And if we can build this network, instead of reinventing the wheel, but really trying to build capacity at that community level so that we can all be learning from one another. This is a very fancy, very confused, cluttered slide, but it's the logos of all of the different partners who are officially members of our task force. And I included this because I think it's really important to note that this is not just Sandra and I, and it is not just the folks at AARP or us at UMass. We have this may not even be everybody that's on the task force, but this is really a partnership, a robust task force, all of which include stakeholders who have been working in this area or in tangential areas and that are really committed to making this work go forward. And so we're pleased to be here today. And certainly if you or your organization or your community is interested in getting involved, we are a very welcoming group. And we believe that the more the better, the more the merrier in terms of doing this work. This is just the mission that we kind of came to in terms of what our task force is doing. Our mission is really to ensure that all residents of the Commonwealth feel connected to their community and enjoy a strong sense of social well-being. The way that we do this is by mobilizing thought leaders, partners, statewide organizations to join forces and to use our collective resources and our collective ingenuity for making an impact in combating loneliness and continuing to ensure that communities are connected to themselves and to others. We've, as Sandra mentioned, we got together in 2019, December, just before the pandemic hit. As a result of that, we ended up holding, so all of our grand plans were a little bit derailed, but in the spring of 2020, I'll just note, we did do 4 regional listening sessions where we engaged more than 300 stakeholders. We had them, we had one in the Berkshires, we had one on Cape Cod, one in the city of Boston, and one on the South Coast, and actually one in the sort of Metro West area as well. And we brought people together via Zoom, which was very, Zoom was we were just sort of getting into the Zoom world. And so but the whole idea was that we wanted to hear, what are people doing? What are the creative ways people are looking around and saying, we know this group is isolated, or we know this group is struggling to make ends meet. How can we come together as a community and support them? Then that work resulted in a report that's called It's the Little Things, that was released on National Good Neighbor Day, which is always September 28th. So mark it in your calendar for 2022. That report then also sort of got us some nice press in terms of the Boston Globe, the New York Times, Comcast Newsmakers, really trying again to get the word out. This is not just about us as a task force, but really about how can we learn and raise awareness of this issue as a social problem. In terms of that, sort of how can we get the word out, we did develop a social media campaign, really a public awareness campaign, using the hashtag ReachOutMA. That started really in the fall of 2020, or I'm sorry, the beginning of 2021. We ended up doing a number of public service announcements. We included Mayor Walsh, 5 other mayors from cities around the state, Secretary Elizabeth Chen, Len Fishman, who was at the time the director of the Gerontology Institute, and Michael Festa, who is the director of AARP Massachusetts. These were also played not only on social media, but also through the Mass Access Network, which is our public cable stations, really trying to reach folks who are not connected to the internet, which we know is a huge barrier. And Sandra's going to talk about the fact that that's one of the areas that we're hoping to work more on. But that Reach Out Massachusetts campaign, again, is really to try to raise awareness about this issue so that we can get people talking about their own social connection. We did go back to those folks who were highlighted in the It's the Little Things report, and we dug a little deeper and we got a little more information about them. We put that in a new report that was released in 2021 called Promising Little Things. And it's the idea that we're trying to move people towards an evidence base, trying to move them towards being able to say, this isn't just a great idea, but it's also a great idea that's backed with data that says it actually works. And so that's where I sort of fit into the puzzle. Sandra Harris has also been named a Gen to Gen fellow, which is an Encore. The organization called Encore has recognized her for this work, and she's really using that opportunity to expand our work. And so we've been doing a lot of work on this issue. We're a hardworking group, and we're hoping to really continue and evolve and adapt as COVID continues to shape the way we communicate and the way that we stay connected. So I'm going to turn it over to Sandra, who's going to talk about sort of where we are now, what we're up to, and you can be thinking to yourselves about how you might want to be involved in any of these short or long-term goals. You can get in touch with us. Of course, we're always willing and interested to hear what's going on in your neck of the woods. So Sandra, go ahead and take it away.
Thank you, Caitlin. As we look forward to our next steps and our plans for the new year, our new goals include continuing to work with partner organizations and also to gain additional membership in our committee and our task force work. We decided very early on that we wanted to be community-based. We want it to be grassroots energy, and that we're not working top to the bottom. We're starting in the community, understanding what's happening there, how loneliness and social isolation is manifesting itself in each community, and we want community members involved. So we welcome all to our table. We planned as we go forward to develop, based on what we're learning and what we're seeing as what we ought to be doing. We plan to develop new and innovative programs and templates that can be measured. As Caitlin has said, we saw a lot of good things that were happening in the community, but From an academic standpoint, Caitlin knows that before we can promote these as best practices, we have to take measure them for success. We need to be able to say, not only are they working in this community, but they have the potential and the measurement to work in all communities. So we want to develop templates and programs that we can measure and that can be easily replicated and taken to other communities. One of the things that we're hoping to do is to really start by helping to bridge the digital divide. We know that there are a lot of older adults who are not connected. Far many are becoming connected, especially as a result of COVID. But we know that there's still a lot of hesitancy and people who are not feeling comfortable going online and doing things online. Hey, folks, the genie is out of the bottle. It's not going back. So we really need to have everyone online and feeling comfortable in doing that so that they can participate fully in society. We hope to do that by creating digital skill building exercises and workshops, online, education online and in person when it's safe to do so, to provide training, practice sessions, because, you know, I personally will read or watch a YouTube video and I've got it until it's time for me to sit down at my computer and use it, right? So we think it's important for people to have training sessions so that you become more confident and build your confidence in staying that. We also want to provide what we call, think in terms of geek support. So if you've got a problem, there's someone at a senior center or wherever, some community center, where you can actually go and sit down with a person and help you figure that out. And then we also want to provide opportunities for practices. We're looking at promoting the idea of tech cafes so that, you know, on a Monday morning, if you want to go down to have a cup of coffee and sit down and talk with someone about skill building, then that will be available. We want to work with local communities and other organizations to help to identify and provide accessible, affordable devices, and also to help to promote advocacy for affordable and robust broadband and Wi-Fi, because we do know that there's some areas of our state where there's slow connectivity as well as affordability. People just can't afford it. So we're hoping that with some of the ARPA dollars, as well as the new infrastructure bill, there might be some funds available where we can kind of help to advocate for robust broadband in areas throughout the Commonwealth. And we feel that this is an issue that has to be resolved by everyone, right? We need all generations to be on board and being a part of this. So we hope to recruit and invite young people building intergenerational connections that lead to not only understanding the digital world, but also in, developing mentorships and friendships. You have seen the research in young people. I saw a report just this morning talking about how depressed and lonely young people are. Well, we think that this might be a really ripe opportunity to develop mentorships and friendships, because we as older adults have so much to offer young people. And then we also want to begin looking at collaborating with local communities to create more socially connected, safe, and welcoming outdoor spaces and housing. Caitlin has talked about the Reach Out MA campaign, where we're encouraging residents to reach out to their neighbors. But until we begin to identify those systemic structures that are causing people to be lonely and social isolated, then we're not really going anyplace. Next slide, Caitlin. Okay, and the long range plan, we are committed to the work that we've already been doing. We are enhancing and creating a more robust public awareness campaign. We hope to build a new and very exciting interactive website starting in January of next year. So we also plan to develop stronger relationships with media outlets, local newspapers, and continuing our work with community television, because we realize that a lot of people are not on social media, right? And that a lot of people, especially older adults, get their news from community television. So we plan to continue our building on those that we already have in place. We're going to continue to build out the Reach Out MA campaign, encouraging base staters to renew their social contracts, to remember what it means to be a good neighbor, and let's go back to that. And we're really able to do so, to reach out in small, safe ways. Write a letter, make a call, buy your neighbor a cup of coffee, say hello, wave while someone is sitting at the window. We are seeking research and funding opportunities to build the evidence. Massachusetts has been recognized as leading other states in the work that we're doing. I think we are the only one, or at this point, we've been recognized as the only state that has taken such a statewide approach to this solving this problem. So we want to stay leader, right? We want to stay in at the head of the pack. So we want to, we're trying a lot of things, but we also want to find research dollars and funding opportunities to really begin to let the researchers like Caitlin build the evidence and to expand the body of knowledge and to really share these nationwide as best practices that are working in communities. And lastly, we want to continue to recruit and invite older adults to the table to make sure that we are hearing the issues and what you're actually facing in the community. We want you to keep us honest. We spend a lot of time through the community conversations, as Caitlin has said, trying to understand how loneliness and social isolation was manifesting itself in communities throughout the Commonwealth. We want to make sure that we continue that dialogue. So we have created a group, our panel called Valued Voices, where we want older adults to come to our table, provide impact, input, and feedback to the work we're doing, making sure that we are addressing the problems, because the bottom line is we are trying to solve the problems of our community members. So we need to hear from you, and we also invite you and think this is an opportunity for you to be involved if you'd like to do so. So that's it. Are there any questions?
No, that's wonderful, Sandra. And we can certainly take questions if folks have them. I was trying to respond to some of the comments in the chat. I also listed here our contact information, as we mentioned, if you are interested in participating as a member of our task force, or if you simply want to make sure that what's going on in your community is being heard and learned from and known about. We invite you to please share that information with us. Tell us your ideas, tell us what's going on in your cities and towns. And please feel free to do that using the contact information here. I also put my email in the chat. I'm going to stop sharing my screen so that we can see each other a little bit better in the spirit of social connection. Looks like Robert has a question. I think if you're able to unmute yourself, please do okay. So, Robert.
Yes, Robert, you are correct. We have a AARP advocacy group that meets on the first Friday of every month. And that's where you hear about all the kinds of things that we are advocating for and pushing for. Things, for example, the one that's the biggest for us is making sure that lowering prescription drugs cost is included in Build Back Better. Also, looking at the caregiving tax credit. That's I guess there's a hearing next week at the Massachusetts House on that. So that is a very, very good organization, or a good opportunity for you to learn about all of the advocacy issues and things that AARP is fighting for. It's the first Tuesday of every month. And if I put my email in, Sandra Harris at AARP.org. If you're interested in joining that, just let us know. But thank you, Robert.
Thank you very much.
Well, I want to say thank you again for your time and for the opportunity to be here and to share our work as a task force with you all. And please spread the good word in your cities and towns. Be in touch with us. We want to hear from you. And take care and have a safe and healthy new year.
And always remember to reach out.
That's right. Reach
out to your neighbor. Thank you. Bye
Thank
now.
you all. Take care.